Altaf Hussain.
Thank you very much, Deputy Presiding Officer. I'm grateful for the opportunity to contribute to today's debate. We have excellent ambulance services here in UK. Ambulance response, I have a lot to speak, but I don't have time. Ambulance response time are an indicator of system failure, and that our staff, who are exceptionally capable, are now being let down by a health and care system that is badly configured, where patient care is being compromised by long wait to be collected, long waits in our ambulances outside the hospital, and long waits in any department to be assessed. Much of this is sadly not new, and the fact that we are here yet again debating ambulance response times tells us that the government has not resolved the problem. COVID-19 has slowed us down, and it has shown us our weaknesses in how we structure and plan our health and care system. I want to focus my contribution to those actions which the government could consider, addressing some areas which would affect our emergency provisions, specifically, number one, improvements to out of hours and the operations of any department. Number two, measures to lower the rate of bed occupancy. Number three, ambulance staff recruitment. Firstly, we know that out-of-hours services can be effective, but they are hampered by not being able to access on-site diagnostic tests. Instead of referring a patient further up the line to establish the nature of the problem, why can't the government examine the resources available to our out-of-hours to improve their effectiveness? Addressing this capacity outside of A&D department would be beneficial. Equally, the operation of any department requires attention, and so too do waiting times. We need additional space, more trained casualty doctors, and observation wards. Well-trained accident and emergency consultants should be in charge on the floor, and the number of doctors has to be increased to eliminate the inhuman waiting times in the departments. It will also allow an effective ambulance services. They are also concerned about the hospital by night, which in many hospitals has created a lot of problems, both for junior staff and delivery of health care to the people in emergencies. The services delivered by medical staff who may have no experience in that field, if this service must be continued, then it should be delivered directly by the consultants of different specialties in the A&E department. Otherwise, in the interest of the delivery of the patient care, it should be stopped immediately. And in addressing the problem of capacity in A&E, it is time that the government considers how the NHS responds to a flu. We have this debate every year, winter pressures, and what to do about it. In my view, those with flu should never have to be dealt with in any department. They should have a separate door to the medical department to go to. It is like a road traffic accident. When the road is blocked, the police finds a diversion. It is the time in the case of flu victims. Any department should not have to cope with this extra surge in patients, because the plan should have been made knowing that this was going to happen. It always does in winter. I would like to ask the Minister what assessment can she offer of the likely number of people requiring hospitalization this year because of flu and the anticipated impact on the ambulance services. I hope she will address this point, because I want assurance that the government has a plan. Deputy Presiding Officer, this brings me to my second point, and that is the difficulty in helping people to leave hospital when they are fit to do so, and how we can free up beds which will have a positive effect on the ambulance service. We know that around 100 patients are in hospital waiting to be discharged because of brittle state of care sector, as said by the minister to George Russell. Many people waiting to be discharged will need residential or nursing care.
The member needs to come to conclusion now.
I have, probably I'll close it here, sir, and I'll say that ambulances should be in the community looking after people. Ambulances are not a hospital A&E departmental cubicles, but that is what they are being made by the government here in Wales. Thank you very much.